Good evening. Thank you everyone for being here for our Rotary E-Club of District 7710 program. And I will pass it over to Kathy for our introductions of our speaker.
Thank you, Jeanne. It is with great pleasure that I introduce our guest speaker for this evening, Jessica Southwell, to the Rotary E-Club of District 7710 meeting this evening. Jessica is a research associate at the North Carolina Institute for Public Health in the UNC Gillings School of Global Public Health. She is currently involved in conducting research related to the prevention of opioid overdose, providing technical assistance on strategic communication initiatives, evaluating public health campaign efforts, and coordinating opportunities for student, faculty, and community engagement in public health practice and service. Jessica also co-hosts Public Health Behind the Scenes, a podcast featuring stories and public health perspectives on the issues that affect our lives. Before joining the Institute, Jessica served in several positions at the Minnesota Department of Health. She has project management experience as Minnesota's pandemic influenza planner, as well as a background in public health policy, working on various initiatives, including health reform, implementation, and securing legal authorities for isolation and quarantine, mask dispensing, and volunteer protections. She also brings an extensive experience from the nonprofit sector, most recently the Minnesota chapter of the National Multiple Sclerosis Society. She will share her experiences this evening working with Rogers Eubanks Neighborhood Association Community Center in public health policy and in community engaged learning. Please join me in welcoming Jessica to our meeting.
Thank you so much, Kathy, and thank you so much, Jeanne, for hosting this amazing opportunity. I am secretly now openly admiring you all. I've always thought that the Rotary did such a fantastic work, and you can absolutely see your dedication being election night and having so many of you here. So I want to make sure that this is really valuable for you all and is on point with what you would hope to hear. So please, I think you're all on mute now, but please feel free to pop in and ask questions as we go, or ask me to expand on something as we go throughout the presentation. And hopefully you'll hear something that hits for you, what you would like to apply to the work you're doing, or maybe it sparks an opportunity for us to connect more, or makes a connection for us to explore further. So thank you so much for taking an hour on this very important day to connect. So yep, my name is Jessica, and I'll give you just a quick background. It sounded like that might be important to hear a little bit more about, and Kathy did a fantastic job of just giving a quick overview of that. My education to date, this comes up a couple of times, and I think is important when we're working with the community, particularly when you're in a privileged area, such as where we are in Chapel Hill, Durham, and Raleigh in North Carolina. I'm a first-generation college student. I came from Mitchell, South Dakota. If any of you have been fortunate enough to travel through Mitchell, South Dakota, you may remember seeing signs for the Corn Palace. So it's a very rural part of the country. It makes most of its money on tourism and hunting. And that's important to note when you think about where people are and where they come in the context of a community. And I'll talk a little bit more about that. So for me, I have a rural background, first generation student, have more that we can talk about there, but I think that is interesting to note that when you think about an academic environment and where I am now, that is helpful, I think, to take into perspective, particularly as we're working with the community. So I received my BA in strategic communication at the University of Minnesota in the Twin Cities, and a strategic communication degree is essentially marketing, journalism, all mashed together into the PR perspective. And when I graduated with my BA, I thought perhaps I would go into a PR firm, do something very, direct in that route, and was working with the Secretary of State's office at the time. It was actually, if we do the math right now, it was 12 years ago, about right now, where I was doing a lot of work with the Help America Vote Act. And so that was getting a lot of voting equipment out to make it accessible for people with disabilities to be able to vote independently and privately on their own. So if you were at the voting election sites today, you may have seen these, not the ballot counter, but the ballot marking machine. You may have seen one of those in your area. So I helped take volunteers out throughout the state of Minnesota and to train the public and educate the public on what these voting machines were. Know that they weren't going to mark your ballot for you. They actually would reflect your choice. So that was a really fascinating job that connected me into the disability community of nonprofits and various groups in Minnesota. And this is really interesting as you think about my career path and the education that corresponds with it. It's never been one that was really well thought out and planned. Some people are like, hey, in 15 years, I'm going to go work here. And that's what they do. I've almost been able to see opportunities as they've arisen, and timing has just worked out to be able to progress and move into paths that worked for me at the moment. But after graduating from Minnesota, I went to the National Multiple Sclerosis Society at the Minnesota chapter. Was there for a year, and I'll talk a little bit more about the work. Ended up moving into the state health department. Thought that a graduate certificate in preparedness, response, and recovery, this is a big deal at the time. After 9/11, preparedness was really on the forefront. So I received a graduate certificate at the University of Minnesota there. Was interested. Health reform was a huge topic at the time, and emergency care was really a window into healthcare at the moment. So received my EMTB state and national licensure. And then recently in 2012, received my MPH in public health leadership at UNC. And so you can see a little bit how that matches where my career path took me initially. So the first job right out of school was with National MS Society, the nonprofit Minnesota chapter. They're a national group. And I worked as the legislative liaison for them. And what that meant is that I helped with some of the policy bills. We had a consortium of all groups of representing different populations of disabilities, both developmental and physical. So it was a really unique opportunity to start in a public health environment that I hadn't been very specific or thoughtful about up until this point, and really saw that in the support groups that we were able to lead with different constituencies, the different issues that they're facing, primarily around Medicaid and Medicare. A lot of the big pieces that came out and were put forth into the ACA right now around issues like the donut hole or having too much money to be able to qualify for services. So when an opportunity arose at the Minnesota Department of Health for me to join as a legislative liaison, I thought that was actually a fantastic next step in my career. The policy piece, really, I was interested in it all along. So to be able to link into that, but then still be doing something that was really good, working to promote the health and safety and well-being of everyone in Minnesota was really right in line with that. So worked for 3 legislative sessions in Minnesota. Those run from January through May on various initiatives. And then during the summer months, I would work to actually help support the implementation of those initiatives. So health reform was a big deal. We eventually had the isolation and quarantine laws that really shadowed the emergence of H1N1 in 2009. So H1N1 was one of the first pandemics, if you aren't deeply immersed in this world, that really, I think in our recent history has highlighted how important partnerships are and collaborations. And what was really unique in this situation, because of my ability to do, to see the big picture and to get down into the details, it really was a nice opportunity for me to come on and lead the pandemic influenza planning aspects for the health department. So was brought in for that. We responded to H1N1. Part of CDC, the cooperative agreement that we had was that we had to revise our pandemic influenza plan and submit that to CDC along with a whole list of requirements on how the health department had responded. And that was what brought me up to about, I think it was February, March of 2010, when there was a national conference that we attended, and we had just learned that we were going to be moving to North Carolina. My husband was recruited to work at RTI International. We have family over here on the coast. So it was a really good move for our family. I met someone at the Institute for Public Health. They had at the time a Center for Public Health Preparedness. So just said, hey, I'll be in your area here soon. It would be great to catch up and learn more about what you're doing. And through that, was able to join the Center for Public Health Preparedness, got into the program at UNC, worked as a research associate or research assistant with the Institute. And then after graduating, there was a biosurveillance project that was happening within the Institute. So they hired me on to lead that with my previous background and skills. That seems like a really good match. So again, this is interesting because if people ask you to describe your path, it's like, so how did you get here? It just, again, there wasn't total intention in this, but the right opportunity seemed to come up at the right time. Where I am right now, that I'll talk a little bit more about and we'll focus in more specifically in a bit, is funding for preparedness has sadly, as it does, unless there's something big that requires our attention, it's diminished, and a lot of the preparedness programs that I was working on in the past are gone. So we've restructured to respond to different funding sources and needs. And so what my work is on now is 60% of my time is funded on a Robert Wood Johnson Foundation grant that works with the Network for Public Health Law. And so I support, this is a really fascinating thing. If you ever want to connect with him, he would love to talk with you all, I'm sure. I support one of the very first legal fellows, Gene Matthews from CDC. He worked there for many, many years, who just happens to be based locally here in North Carolina in Chapel Hill. And so he's leading our southeastern region of the grant for this project, which will be growing and morphing into more amazing things in the coming years. But that's where a lot of my research on opioid overdose work comes in. And interestingly, pulling the EMT piece into that, we have done research on scope of practice laws across the country. It used to be just a couple of years ago that only the paramedics, so the EMTPs, were allowed to administer naloxone, which is a life-saving drug that can bring someone back from an overdose. So it reinitiates their breathing. Now, because of attention that we've drawn to this issue, which is really neat to see those political windows as they come up, basic responders from police, you may have seen this in the news, to basic EMS, first responders, or even family members can now administer the drug because it's available in an intranasal version. So that's been an exciting project. So that was 60% of my time. 40% of my time, which is why what I'll talk to you a little bit more about today, is on practice. And again, before coming into public health, if you call something, like, tell me about the practice of something, I'd be like, okay, what's that? And I think the closest we can come to it is really, it comes down to the essentials of the act of doing something. So for public health, it's those who work in public health who are doing the public health work. So I'll talk a little bit more about that. And because service is so important in my life, and hopefully in the different ways that I can contribute, these are just a couple of the ways that I'm currently engaged. And this is, again, a picture of where you are in your life. We have a soon-to-be 11-year-old and a soon-to-be 3-year-old. So being able to volunteer in the classrooms here is fantastic. I'm very appreciative that UNC has a benefit that allows you to take some time, paid time, to go off and do some public service work. So that's a really great benefit. So serving in the classroom, serving in the PTA, the wellness chair, if you have any ideas on how to do that well or experience, I'd love to hear that. And then my son plays soccer, so serving on the TFCA as team manager, and then most recently with the YMCA as a facilities task force person. That's just a little bit about me. But now I really want to take some time to go in depth into what I'm going to call community engaged learning at the Gilling School. And this took a while to actually get here. This community engaged learning, it's been a work in progress. So I started off just under 4 years ago working on this practice piece. And how we got there is the Institute Director, Anna Schenk, was appointed to be the Associate Dean for Practice. And they also, at the Gilling School, started this Professor of the Practice designation. And this is a huge shift because it pulled attention from being very research focused at the school to also recognizing the importance of practice and service is a part of the mission of the Gilling School. And so my director, Anna Schenk, she and her colleagues at Michigan were, sharing stories back and forth about things that were really effective. And they decided to try these field trips. The PH stands for public health. And the field trips, the goal of that was to encourage students to connect into the community, to learn more about how you can use your public health degree in the real world. So I'll talk a little bit more about that in depth. But the field trips were really the first start of this engagement across the whole school. And for those of you who can think back to their academic, like the Gilling School has 7 different departments within it, and they each, it's a benefit and it's a strength of the school, but it can also make it a challenge. They all are really wonderful and strong, but operate independently. And so my role at the Institute has been to support students across all departments and provide these opportunities across all degree levels and all departments to participate. So came in and was assigned the field trips as one of my first projects. Through those field trips, it was really fascinating to talk with community partners. We worked with Orange County Health Department and still carry on that role with them. And then also RTI International, we have a close relationship with them, and heard from alumni and also folks who were possibly interested in pursuing a degree, furthering their education at the school, that they would like to be involved or figure out ways to connect into the school. So through those conversations, I realized there's more that we can possibly be doing than field trips. The field trips are a great start. Back to that preparedness funding, the school had this Team Epi Aid group. Some of you may have heard about that before. And this group was really unique. They were able to go out and help provide essentially surge support to local health departments. And I started to think about this a little bit more after reading what Hopkins had done with their SOURCE program. And the SOURCE program is a student engagement and resource center. They link students to community partners, and they're able to do volunteer service with them. And we can talk further about that. Recently, we started a podcast, and we've also been able to do some more work in building this community engaged learning program with doing the accreditation piece of it through SEAF. We're in our accreditation process right now. And what we've learned through that is we really needed to link this all better together. And so we have practice at the school. This includes practicum, internships, capstones, and then for service, this is volunteer activities, student groups, service learning courses, and for the faculty, this is mentoring and technical assistance. And there really is so many opportunities for us to connect students into the work of the community and the community into the work of the students. Through the podcast, we've been able to see some of these opportunities. There's a couple of episodes here that cover topics that we've done. The refugee crisis was, pardon me, a fantastic one that really was doing a large part to what Dilshad was able to connect us to. And we've also talked about diapers, service, sleep, will be coming up soon, and really just some great opportunities for us to connect with the community there. To delve into this a little bit further, how it's been fascinating to use these different ways to connect is Dr. Dilshad Josh Hinson over in the School of Social Work. We've been able to take their expertise and use it to focus on a topic on the podcast. And then what that does is it highlights to a broader audience different opportunities that are available. So for students, for example, when we're talking about refugee work, there are a number of initiatives at the school that students were then able to get connected into, whether it's related to research, service, or practice. And those opportunities then lend for additional support for Practica that can continue. So it's really fascinating not to just do these one-off events, but to be able to make it go that extra step and to see where else these pieces can lead. And if you're interested in learning more, you can hear more about us at publichealthpodcast.com. Pardon me, I'm on the third week of a cold, so I still have a little bit of a remnant of cough, so hopefully that's not too distracting. Part of the other work that I do, so with the field trips, I'll talk more about this in depth, and that gets us over to the Rogers Eubanks Neighborhood Association piece. We do a number of events. The Gilling School Practicum Day, it's a really exciting opportunity. Basically, any student who has a PH in their degree at the Gilling School is required to do a fieldwork experience or practicum. And the hourly requirements vary, but typically it occurs over the summer. So in your organizations, if there are opportunities that you need additional research support or some projects that a master's level or a bachelor's level student could benefit from, this is something that we could help offer as a connection. And Practicum Day is coming up on December 2nd. I can share this information afterward, but it's open to the public, and it's a really fantastic way to see all the work that the students have done over this last year, and to maybe even get a sense of the different skill sets that they can bring to you. We also help coordinate Public Health Thank You Day and National Public Health Week events. And then coming up, we have our eye on trying to do at least one Gillings Day of Service. So if you have projects or ideas on how to help with that, we would absolutely be interested in partnering with you to do more. Here's just a few pictures of our events. My husband is on the right-hand side of the street. He does a radio show that talks about social science. And so we brought him to do a live radio show from the school. Dilshad is in the bottom corner. We're talking about mental health there. And then the CEO from FHI 360, Patrick Fine, is sharing more information on, I think service was a topic that we did for that event. Okay, so we're doing all this stuff, right? And I think what is important whenever you're reaching out and thinking about how you're connecting the work that you're doing into the community, I think it's really important that you're focused on community identified needs. And so I think what is really compelling about what I'm able to help do at the school is we have this opportunities page. Some of the current opportunities that we have for students, faculty, staff, and even some members of the public to engage with us and help support the community are listed here. So Hurricane Matthew, we have a current relief page up where students, faculty, staff who are directly affected by Matthew can send requests for volunteers or goods and services to us. We're also supporting the Food Bank and the Diaper Bank of North Carolina through some of our efforts. The after-school program at RENA is recruiting volunteers actively. We also have an opportunity for students through ACS, the American Cancer Society, to develop social media campaigns right now, which is a really, really exciting project that they're doing. Let's see. And then we also have work through the community kitchen that is going on at this, pardon me. And recently we've had, since Flint, Michigan has had the water crisis, we've worked with DPH, the Division of Public Health here in North Carolina, to help do child blood lead data cleaning that I can share more about. But this is what our opportunities page looks like, and you can access this right now from your computer. And you'll see as opportunities or requests come into the school, my job is to help coordinate those requests. And we share this out and distribute it through a listserv. Every week we have all of the department leads send this out to their students directly, and it helps to get the word out about what needs are. Within each of these, you can click and there's more information. For example, the After School at Rogers Eubanks Neighborhood Association gives more detail about who the group is, what the opportunity is, and specifics that are helpful, including a contact information. Some of our opportunity pages have used Sign Up Genius to help people sign up for shifts or to sign up to give a program or a service. And so that's basically how we coordinate at this point. So would really love any ideas or suggestions for opportunities if you have any come up. I do want to talk now a little bit about Rogers Eubanks Neighborhood Association, which I think if you don't have the opportunity to connect with us through UNC, they are a fantastic group that you can connect with directly in different things that you're doing. So the Rogers Eubanks Neighborhood Association, they're fairly new. So they started in 2007. But before that, the Rogers Eubanks neighborhood has been around for hundreds of years, since the start of Chapel Hill, essentially. And they've been around because they're a traditionally Black neighborhood. The slave owners in the neighborhoods, the Blackwood families and the Hogan families were doing a lot of the farming in the area. Over the years, the land was traded down and given to the families that are there today. And in 1972, unfortunately, a landfill was approved. Let's see if I can get there. You'll see here on that red dot, it's basically right in the backyard of where this historic Black neighborhood was. Lots of politics went into that, and you can imagine the decisions that had to be made. But over those years, the people in this neighborhood, they saw a lot of effects from the landfill, and really institutional racism issues highlighted more so than ever. They complained and thought that the landfill was affecting the quality of their air and the quality of their water. People didn't listen, so they came over to the School of Public Health, and we had some folks in our environmental sciences and engineering group help them actually be able to test their own water and do the samples and take almost diary results of what they were experiencing, and worked over time with community members and legislators and partners, basically just advocating for what they needed. So in 2007, they formed this formal group, RENA, the Rogers Eubanks Neighborhood Association, and continue to be some of the strongest advocates that you've ever met. They are also largely ministers within their area. So it's a natural fit. They're community leaders, and they not only advocate for what the community needs, but they also are very in tune to what the community needs are, because they're seeing them on a day-to-day basis. They live there in the community. We live right across the street from where this community center is. And as a promise to the community, the Rogers Road Community Center was built in 2014. So RENA, there's so much to say about them. And Dilshad and Naya, a colleague, and I, we were there helping out with their back to school effort, where they take all these school supplies and donated book bags, and they brought in 30 to 40 volunteers and packed school bags and gave them away, over 550 school bags, backpacks, to families in need throughout the community. And they did this before the school year started. They also coordinate food bank materials. They do after school tutoring, a Christmas toy drive, and back to school prep. They host and run a summer camp. They do a community garden and so much more. And I think they're really, you can look more into their story online, and I would recommend that you even look and see if you can go ahead and order a copy of the book that was written by a public health student who is doing their practicum with this group. But they're so driven to help connect resources to their community. And it's not just for people within RENA, it's for families in need throughout Durham, Orange counties, and even Wake County. So they're doing fantastic work, and I'd be happy to connect you more with them at some point. I'm just trying to check time. So I think when I think about like what I could offer to you all is, if there ever is a need that you want to help promote, where you think students could help support different opportunities that come up, whether it's related to practice, service, or research, I'd be more than happy to list this on our practice, service, and research opportunities page. You might have an idea that would make for an excellent podcast. I can talk more about that. We have been downloaded in over 50 countries, over 15,000 times through the course of our show. So the reach is there. We do it in an accessible way, I'm proud to say, where if you can listen to the podcast and stream it on iTunes, but you can also go online and see the transcript of the episode printed there, along with pictures that tell more about the story. I'd be happy to host you as an event as well, if you think that there's a topic that you would like to do a speaker series or a film screening for. So I would recommend, if you have ideas in the future and want to connect into the Gilling School and the students, faculty, and staff, or community partners, hopefully we can find an opportunity to make that happen. So I'd like to open it up now for discussion ideas that you might have for ways that either Gilling School students or other students could connect with you for service and practice, events, the podcast, or other ways, or if there's other things you think we should be doing, if there are other ways that we could support you in your work. Thank you.
Thank you so much, Jessica.